everyone. My name is Jareen Baustisa. I am a theater actress and I'm currently a student in the Ateneo de Manila University. And I am here to have my baby Botox treatment. This treatment is meant to, I think, for acne prevention, oil control, and pore size reduction, and an overall flawless skin. So I can achieve my baby skin. Don't forget to hit subscribe and click the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic on baby skin laser and baby Botox. Before we talk about those, let's welcome our guest for today, Miss Jareen Baustisa.
Hi everyone.
Welcome. So Jareen is 21.
Yes.
And taking up a course on?
Like what I'm studying?
Yes.
Communications Technology Management. Diba ang haba?
Wow, that's the thing right now, communications, something.
Yeah, Comtech.
Comtech. Okay.
Yeah.
So, looking at Jareen, okay, she still looks like a baby face. She told me she's 21, but I thought she's only like a grade school student. So, if we assess Jareen's skin condition right now, actually, she had already overcome the problem of acne during the teenage years. Okay, when we were teenagers, we had some the complaint of like those blackheads, whiteheads, okay? And actually, majority of those young ones, like 80% of them, when they reach the age of 20s and above, the acne problem will just stop, okay? So now, actually, in this time, the common complaint of people will be the so-called mask acne, and then others will have this sebum production or oiliness of the skin. The others will have a concern on the pore size. They say that I have large pores, and the others will have some concerns of like pigmentations also. The others will like under the eye. Okay, looking at Jareen around the eye region, I noticed like there's this sunken or hollow under eye condition causing this effect of pigmentation, dark circles. Probably Jareen napupuyat sa pag-aaral.
Yeah.
Because with the online schooling right now, so they tend to, of course,
sleep very late
because they still have to finish a lot of those homeworks or assignments, right?
Papers.
Yeah. And then with Jareen, so the skin condition, I could say, of course, most of the time the T-zone is rich with sebaceous glands, oil glands. So you will notice that there will still be some kind of or degree of oiliness there. So sometimes you will still see a little bit, just a little bit of like comedones, tiny comedones on the T-zone region. But the good thing with Jareen, she's able to control it. She has a very good skincare also, right? Yeah, very good skincare. It's very important to prevent acne formation. And then if you're gonna look at the cheek region and then the lateral aspect of the face as well as the mandibular and chin region, well, just this anterior cheek region, particularly on this side, the right side, I noticed some mark or like probably a pimple blemish or a little bit of the spot there, okay, just on this side. Well, Jareen has a concern of particularly the under eye region, okay, and then also the open pores. And of course, you would want to maintain that skin that's gonna be flawless or like still like a baby skin, right? So even I would still want to have a baby skin, right? So we have to do something to achieve that. Okay, Jareen?
Yes.
So now Jareen is 21. I was mentioning before that, well, they were saying that aging could start at the age of like 25, okay? When you say aging, what's aging signs? When you see already some lines, beginning lines there, or some grooves, or some folds, or some sagginess, or the skin is losing its so-called tightness or firmness. There's the so-called laxity. Okay, for Jareen, when I ask her to like frown, you frown, Jareen. So you notice a bit of some line already there. Okay, I think genetics also play a role.
Yeah.
Yeah.
Both
Sometimes-
parents, I think.
Okay, so there could be a role of genetics here that you can inherit what the parents have. Like some people would have this line in the center of the eyebrow region or the frown line that they call it. And some people would have like a prominent forehead line. Raise your eyebrow, please. So like a beginning dynamic line already. I think the generation right now, I could say that we have this so-called premature or like an accelerated aging because of the lifestyle, like puyat, lack of sleep, and I think stress, fatigue.
Yeah.
Okay, with the kind of the education and of course with this pandemic thing, you know, stress hormones are elevated, cortisol hormones are elevated, and like it affects our skin also. So those factors are affecting our skin, the looks of the face, the volume of the skin, the laxity. So what kind of treatment could we do that doesn't have any downtime to address those concerns? And of course, for a very young skin, a baby skin like Jareen's, what kind of something to control or prevent it? Okay, ating abangan sa pagbabalik ng CSA Medical Aesthetics. And we're back, so we'll now show you the procedure for the baby skin laser treatment. So before doing this kind of procedure, you have to do cleansing of the face, and then you can also apply your topical numbing cream. Leave it for about 15 to 20 minutes. Now I have my electronic Lash MD here. I use this as my treatment for like pore size reduction, blemish treatment, skin tightening, skin firming, and it's very gentle on our skin. It has a sodium fractional laser effect. So when I do it, I always start on the lower part of the face, the chin region. Okay, so we'll just press on the ready button there, and then I'll touch the chin region. Okay, just a gentle glide, Jareen. So just gliding you're okay. So there's this like pulse-like sound there. Okay, we'll just glide it like that, and then do it on the upper part of it, and we'll just glide up to the lateral aspect of the face. Okay, so you'll notice a little bit of an erythema there, which is an effect of the laser, but in a little while it's gonna go away too. So we'll just continue all throughout. So that's the lower third of the face. Now let's proceed to the middle part of the face. So it's just a gliding. As you can see, there's a light beam from this handpiece of the laser, and it's targeting the epidermal region, so that it's also gonna target some of the skin blemishes, and also up to the dermis, targeting the fibroblast cells to stimulate those cells to make new collagen fiber. So that's the mechanism on how it's going to induce skin tightening effect. So after the horizontal glide, I can do the vertical glide. So you can do a double pass like this. So doing the lower third of the face first. Okay. And then after that, the mid face. Okay. Since we have a concern on the mid face region of Jareen, particularly the infraorbital region, you can make a pass on that inferior orbital region just to target some of the pigmentations there. So I also use this for whitening and brightening treatment, so I can make a simple pass under the eye region, then another one. So it's also gonna exfoliate the skin in this area. So for those with concerns of dark pigments under the eye, you can use the LASMD to target that problem. So I'll proceed to the upper third of the face. I'll start with the center area. Okay, I can do my vertical glide. So you can do 2 to 3 passes for each area. You're okay, Jareen?
Yeah.
She's okay. So the good thing, we were able to have the lidocaine cream a while ago. So I'll proceed to the temple region here. So I already do multiple passes in the temple. Then I'll go back, horizontal, another horizontal there. Okay. So you can notice already the effect of the laser on her skin. So we have a type of skin that's also reactive, meaning to say her skin becomes reddish with every laser treatment. And take note, this is just a gentle laser. So we want to do a procedure for Jareen that's also gentle because her skin is kind of sensitive too. Okay, so we'll proceed to the other side. So the horizontal gliding, you can also do like a double horizontal gliding on that part. And then let's proceed to the mid-face region. So far so good. So the laser is targeting epidermis to superficial dermis, and it's like creating a microchannel. The good thing with this type of laser, you can infuse micronutrients to restore the radiance and to maintain the health of the skin. So you need some booster of like vitamins and minerals. So later on, we will be applying topical vitamin serum. So for her age, we can use the vitamin C. For others, we use the so-called retinol or the vitamin A. And those with melasma or very dark pigments, or rather PIH, we can use the tranexamic. We also have the stem cell for this one, as well as the resveratrol, which is for anti-aging. But for Jareen baby skin laser, we can use our vitamin C. So I can also target the skin on the nose region. So just gentle there, just to also improve the skin here. Okay. And then on the upper part here. So we are done with the baby skin laser. So now we want to also do an acne control or acne prevention treatment. We wanted to also reduce oiliness. We also wanted to reduce the size of the pores. And we want to do skin tightening and firming at the same time. So after doing our LASMD baby skin laser, let's proceed to the so-called microxyomine intradermal injection, or microtoxin intradermal injection, or baby Botox. Easier to understand, right, Jareen? Okay, so with Jareen, the concern is on the anteromedial cheek region, as well as on the glabella and on the forehead part. Because here, I'm noticing some of the so-called comedones. Now, her U-zone is okay. So what I'm gonna be targeting only will be the part of the T-zone and as well as the anterior cheek region. So I have here a 5-unit incobotulinum toxin type A. So I'll have Jareen turn her head towards the left side. So I'll be starting on the right cheek here, anteromedial cheek, and we'll be using a 5-unit incobotulinum toxin. So I no longer did the markings, but you can also do markings before doing such procedure. And I'm using a very small syringe here. It's an insulin syringe with a 5-unit dose of our incobotulinum. So again, turn to that side please and close eyes. And then let's just prime the medicine. Make sure that it is primed. And then I'll start with this lateral aspect here, just a tiny bit. Inhale, exhale. Just the tip of the needle, and you just create a tiny bleb there. And we wanted to create a first column here. There you go. Just a tiny bleb there. Okay, make a straight line. So I'm noticing also some visible pores, so we wanted to reduce those pores. So it's just a 15-degree angle of your syringe. Okay. Just like a tiny injection here. Now the second middle column. Okay, and then just a tiny bleb, tiny injection. So it's like creating a tiny blunt bleb or a tiny wheel. Okay, so I'm on my 6th injection point. So for every injection point, you can give as much as 0.5 unit of your incobotulinum toxin. Okay. But again, this is intradermally. So when you say intradermally, you're within the dermis layer. You're not going into the muscle layer, because we do not want to touch those muscle layers in the cheek region. You know what will happen? That will cause some like effect on those smiling muscles. So we just want to go to the skin layer only. Okay, I'm done with the right side. So we can do the left. Okay. Jareen, okay ka pa? I'm just doing it like a gentle approach. Because the others, I'm doing like pak. No, Sandra? For Jareen, we just do it minimally. So I'm just gonna finish this syringe here. So like here. Actually, the left side is better than the right side.
So it's less.
Less. So we'll just use less dose here. Okay? So again, so I'm just gonna be injecting into this part here. So we'll do less in this part. Pero this one, 2 columns only, okay? Because less of this side here. So this is more of a prevention. It's not really a treatment, but more of prevention. But you really would appreciate the effect of this one with the pores. So we're done with the left cheek. Let's proceed to the glabellar region, where we wanted to also treat the frown line. Okay, so the target here is the first. I'll be working on muscles here already, the procerus. So we just wanted to have a baby dose, not much of a large dose. And then I'll target the corrugator right. So this one is intramuscular already. And then the left corrugator. So for those who have concerns of frown lines, this is the best treatment for you guys. So you also wanted to prevent that deep static line on the glabellar region, because I see a lot of people with concerns here, static line already. And when we have that, if it's static, the treatment will be dermal filler. As much as possible, we wanted to prevent that. Now, we also wanted to relax the frontalis muscle, but at the same time, also control the acne formation. So here, I can do intradermally, just a single horizontal line here. Okay. Create again another bleb here. Tiny bleb only. Small dots. Okay. So this is intradermal, your microtoxin intradermal injection. Okay. For Jareen, I was doing an assessment on her face. I noticed that in her mid-cheek region, there's a beginning so-called Indian line or mid-cheek groove already. So for her next treatment, when we do a follow-up on this one, we will be doing the so-called O-therapy to do a lifting to prevent that nasolabial fold, and as well as to control the formation of the so-called mid-cheek groove. So we'll do that in your follow-up, Jareen. Are you okay with it? Yeah. So that's non-invasive again. As much as possible, we wanted to do procedures that are non-surgical and minimally invasive, or should I say non-invasive. So we're done with our baby skin laser as well as with our baby Botox. We'll show the result to Jareen when CSA Medical Aesthetics return. And we are back, so we'll now show the result to Jareen, the baby skin laser as well as the baby Botox. So Jareen, here's the mirror. You can check on what happened.
Oh wow, it's rosy. My cheeks are rosy.
Yeah. So we expect some redness or erythema from the baby skin laser, and then with the microtoxin injections, some tiny blebs there, but they will go, or rather they will fade away in just few minutes. Okay, because I did the microtoxin injections, cheek area and forehead up to the glabella, but now I don't see those tiny blebs already. Although I can still see some redness or erythema in a little while, it's gonna go away too. Again, the goal is for acne prevention, acne control, sebum control, pore size minimization, skin firming, skin tightening, and of course our baby skin laser to achieve that baby-like skin. So Jareen will ask you, how is the experience?
It wasn't bad. It wasn't even.
Yeah.
It wasn't even. You feel the needle. You
Right.
feel it. It hurts. Joke lang.
Yeah,
It's fine. It's fine.
Yeah.
It's bearable and very gentle naman. So
Exactly. And of course we are using the baby needle also.
Yeah.
So you know there's something going in or penetrating the skin layer, but it's quite like tolerable because I do that on my face
it's
too.
tolerable.
Right. What about the laser? How was it? What's the feeling?
wala man. You don't feel
Yeah,
anything. You
right.
just feel like
There's something gliding on the skin.
something gliding, but
Yeah.
at the end, towards the end,
Yeah.
a bit of irritation.
Yeah, a
Tiny.
bit. Yes, I felt that too when I do the laser on my face. Like just like a few minutes only that you feel there's this tingling sensation. Or the others were saying a minimal of a burning type.
Yeah.
But that's expected. It's a laser. Okay. So far the experience was quite well. It was
Yeah,
okay. It was
yeah.
fine. And then as to the result, we will still be looking at a follow-up, a 2-week follow-up. We'll be inspecting on the pore size, acne control, skin tightening, and skin firming. So we will be doing a follow-up for Jareen. And in that follow-up, I will be doing a treatment on the mid-face section to target this, like the nasolabial part here. Because I'm noticing right now some so-called mid-cheek groove or this Indian line here. Because Jareen is already like, she's busy with her studies, so the lack of sleep, and you know, she's so masipag, talagang very dedicated to her studies, okay, which is very nice and very good. Okay, will there be any like Instagram or any social media account that some people, because they want to ask some questions to our guests, like how was it, like after a day, 2 days, 3 days, and you might be able to enlighten them? Is there anything?
You
like,
can ask me.
like
I
any
wouldn't know.
account?
I don't know any medical dermatology
Yeah.
or whatever. But if you want to ask about my experience, you can
Right.
tweet me
Tweet.
at Bautista Jareen or message me on Instagram at Jareen
Okay.
Bautista.
Thank you so much, Jareen. Really appreciate your presence. We'll still see her on the 2-week follow-up. Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Derm Centre or CSA Medical Aesthetics, Instagram, CSA Derm Centre or CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Our other topics, other episodes, they're in our YouTube channel. Just type Contessa Salvador. So, maraming salamat po sa inyong lahat. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.